Oh, wait, I see a red thing on.
Yep. There it is.
I'm so sorry.
It's in my left-hand corner. It's a red dot.
Yep, okay. All right, let me, why don't you guys say something? I'm gonna
I
choke you.
didn't notice that it wasn't there. I'm sorry.
All right. It's okay, let me find my, sharing my screen. Yeah, got it. Get this out of the way. Good. Can you guys see the screen? Okay. All right. I'm so sorry. All right. So anyway, this is what's growing in on your teeth and in your mouth, making the biofilms, causing all the plaque cavities. We talked about that earlier. I said that this is growing in your teeth, and you have all the bacteria growing. It's producing an acid. It's fermenting the sugars in your mouth, producing an acid, eating through your teeth there, and it's changing the osmotic pressure and the environment, and other bacteria come along and have a little niche market. You have layer of layer of layer on here, right? So it's not very invasive. This dental or surgical procedures facilitate entrance. So that's why I have to be careful, and that's why they give you prophylactically give you antibiotics for that. Here is that Viridans group. Remember, this is from in your mouth. Bacterial meningitis, abdominal infection, tooth abscesses. Most serious infection causes subacute endocarditis. So the bloodborne bacteria got you, scraped the gums, you had a dental procedure done. This got into your bloodstream. Even though we're rinsing your mouth out, we're putting gauze in, somehow it got into your bloodstream. It's growing in your bloodstream. Bacteria settle and grow on your heart lining or valves. You can see that. See that. All right. So remember, your heart valves and your endocardium, the lining of your capillaries, your arterioles, all that stuff should be super smooth, and it's contiguous. All right. So this should be nice and smooth. It's very rigid. It's very. You can see that things growing on there. Maybe not. They're growing all over it. So persons with pre-existing heart disease are at high risk. Colonization of heart by forming biofilms. Remember, they one going on top of the other, on top of the other, on top of the other. So even if we hit it with antibiotics, the antibiotics cannot get to the most inner layers. It has to go from the superficial to deep. That's why biofilms are so dangerous and so invasive now, because we can't get rid of them. After you have 5 or 6 different layers of stuff, we can't get to everything. All right, strep mutans produces slime layers that adhere to the teeth. This is the basis for plaque involved in dental caries. All right, so remember, this is producing an acid. It's eating through your teeth. Right? Persons with a pre-existing heart condition should receive prophylactic antibiotics before surgery and dental procedures, just in case. All right, let's talk a little bit about strep. All right, strep pneumoniae. Now, strep. All right, so how easy is it to catch pneumonia, do you think?
Not that easy. I mean, I've had pneumonia.
Yeah, walking or regular?
Both.
Both.
All as a kid.
All right, but did you have a pre-existing anything going on where you had it?
Not that I knew of, but you said that you have to have a pre-existing condition to get it.
Well, it's not 100%, but generally, yes. All right, it causes 60 to 70% of all bacterial pneumonias. It's a small lancet shape, if you look.
Right, like you usually have like bronchitis first, or you have some kind of really nasty cold that ends up turning into that. Like you don't just all of a sudden have pneumonia.
Right, so you have a runny nose or something. It could even be, I know people that said, well, I don't know, I was out camping for the weekend. They were inhaling smoke at a campfire, just caused some irritation. You had some inflammation. So there's got to be something going on in the alveolar to weaken it and cause it to change the fluid concentration there. And then you have this, usually you get it from someone else, or you could carry it as normal flora. You swallow this, somehow it gets into your lungs and it starts setting up shop. causes 60% of all bacterial pneumonias. All right, so these are lancet-shaped, arranged in pairs and short change. Cultures require blood or chocolate agar, growing improved by 5 to 10% carbon dioxide. So if I was going to grow this on chocolate or blood agar, I put it in that canister like the candle, get rid of the oxygen. Lacks catalase and peroxidase, right? So it's oxygen's toxic to it. It can't really deal with oxygen. That's why it likes to live in the back of your throat or in your lungs. You'd think, well, you know, your lungs, I'm breathing in air. My oxygen concentration should be high in the lungs, right? You'd think that. But remember, you've got inflammation and the alveolar is like tissue paper, but it's really soggy. It's wet and soggy. It's a little bit viscous because of the mucus, irritating your alpha-1 and alpha pneumocytes are producing that mucus, right? Changing the oxygen concentration. So this, it's slightly diminished, so this can grow quite readily because it's not 100% oxygen concentration. So this produces large capsules. It's the most virulent factor. And once again, we have that specific soluble protein. It's a great big thick capsule. I want you to think of it as like a leather jacket, like a, you know, why do bikers wear leather jackets? Not to look cool, it's in case they fall off their bike. They've got that protection so they don't become organ donors and get the road rash when their skin comes off. All right, but remember, if they get engulfed, they have to consume that, if they get through that protein capsule, which is huge. Causes pneumonia and otitis media. Everyone knows what otitis media is? All right, so it's ear infection in children, usually, because remember, the eustachian tubes are much more level when you're a child. As your neck grows and your head moves, the eustachian tubes get more slanted. But if they're flat, this stuff can go from your throat, it can just spread out into the ears. So 5 to 50% of all people carry this as normal flora. So usually people don't want to hear this, but what if I tell you have pneumonia? Yes. Did you have a cold? Did you have bronchitis? Whatever. Yes. Well, is it possible you self-inoculated yourself? Oh no, there's no way I did that. 50% of cases might be. So it's very delicate, does not survive long outside of its habitat. So this is relatively easy to kill on a surface. You've got to transmit it person to person. And like I said, it's got to grow on blood or chocolate agar. We've got to diminish that oxygen concentration. So young children, if you're immune compromised, other lung diseases, viral infections, or persons living in close quarters are predisposed to pneumonia. All right, this may be possible because if somebody has pneumonia and you're getting it back and forth, it's much more prevalent to get it. And I hate to bring up COVID again, but they're saying right now that the worst thing you can be is be isolated with somebody with COVID, even if they're asymptomatic, because they may have it, not have any signs or symptoms. They're giving it back and forth you constantly. Just something to think about. All right, pneumonia occurs when cells are aspirated into the lungs of susceptible individuals. Like I said, it's in your lungs, or you cough, or it's on a utensil, and you have to aspirate it into your lungs, deep down in the alveolar, where the oxygen concentration is diminished, and there's some kind of compromised alveolar. Pneumococci multiply and induce an overwhelming inflammatory response. This is what perpetuates it. Causes an inflammatory response, very, very fluid, very, very wet. And Katerina, you said you had pneumonia?
Mm-hmm.
All right, so what was your energy level?
Oh my gosh, it was like I had mono. I just didn't want to get off the couch. I had a lot of back pain too because of the lung. It was in my lower right lobe because I could feel it popping.
Yeah, because usually you're standing up, so gravity is gonna. If I did an X-ray on that, you would see it would look much more white or denser because if it's air, it's black. So if we did a erect standing film, we shot it, we'd see the fluid level in your lung. Right? But the reason why do you think you were so tired?
Because it was taking so much more energy to breathe.
Yeah. And how was your Krebs cycle working?
On overtime.
Why?
because you're trying to be able to fight it off while also trying to get enough oxygen, and you're also lacking oxygen because your
Right.
alveoli are filled with fluid.
So you're lacking oxygen. You remember we need oxygen to run that Krebs cycle, electron transport chain. Right. Gains access to the middle ear by way of the eustachian tube. And here they're just showing you strep pneumoniae, pneumonia. The capsule, it's got the huge capsule, it gets inoculated in here. So even if it's down here and your lung, you know, theoretically they say your lung is sterile, right? So, but if your macrophages in your lung are trying to get rid of that, even if they consume this and try to digest it and present the antigen to it, they can't. They can't get through this great big capsule. So we have to send in great big macrophages to go in and constantly work over and over again to try to get rid of that. And there's the eustachian tube. All right, it's going up from the respiratory system up. But remember, on children, it's flatter. All right, so it's easier way to get up. You know the easiest way to get rid of otitis media in children?
The tube?
Adjust their neck and you re-level their eustachian tubes. Didn't hear that from me.
No, I know a chiropractor that swears by adjusting kids, and they always stay super healthy. It's crazy.
And
It keeps ear
adjusting,
infections away.
yeah, you're just using your finger. You're not like cranking like an adult. Yeah.
Right, right.
Is it Dr. Davis? Who is it? Jessica?
Encina. They're in East Aurora. Thomas Encina. It's
Okay. They're on Main Street, I think.
yes, yeah, yep.
Yeah, it's huge. Yep. And then for this, we gram stain the specimen, gram stain it because we'd have that. Remember they're capsulated. We do a special test. We do a Quellen test for capsule swelling. And like, you know, I'm sorry guys, this semester, you guys probably aren't sorry, but we're not going to be doing any of these special stains, capsule stains. You guys don't get to do a lot of this stuff, so I feel bad. But we could do special staining on this. So it actually, the protein capsule on this starts swelling. It's diagnostic for strep pneumoniae.
Are you going to do any videos to show that or no?
No, because number one, I'm not growing it, and number two, I'm recording this, so I can't say why. But I was
Okay.
detoured from trying anything out of the ordinary. Let's just put it that way. It was not well received. Right. Treated with penicillin G or V. We have increased drug resistance with this, so it's a major problem. All right, and there's two vaccines, Nuvax, I think, Nuvovax, I think is the other one. One for adults and one for children. Do you guys remember how the vaccinations work from last week? Anybody?
It presents a dead or almost dead organism or microbe to your body, and so you can build up the memory T cells for it.
Perfect. So I'm actually just presenting the antigen. So any vaccination or a lot of these things, we're going to take part of the MHC1 or HLA marker. That, remember we said that your antigen presenting cells are going to engulf that, break it down, and literally present them. The MHC2 marker presents the antigen. So I'm going to take part of the capsule antigen. All right. I'm going to make sure it's dead if it was a virus, but this isn't, it's a bacteria. We're going to take part of that antigen that your immune system would recognize. We're going to induce it into the body so that your body will definitely recognize as an antigen, make an antibody to it. But we're not injecting the live pneumococcus in it. We're just giving it the part that your immune system should identify, so it makes an antibody to it. And then we have conjugate vaccine for children 2 to 3 months. So we give them a much less viral antigen to this vaccination because once again, their immune system isn't up and functioning. And I personally would never even think about doing this until they were at least 6 months old, unless there was and they were in a house full of people who had it or something. There would have to be an extenuating circumstance where I would ever give this to a child under 6 months of age. But that's just me. All right, let's talk about gram-negative cocci. So everything we talked about before is gram-positive. So gram-negative cocci, what color should these stain? Pink.
The iodine
Pink.
color. Not the iodine
Yeah, Graham's iodine. Yep.
one.
Saffron is a counter stain. So residents of the mucous membranes of warm-blooded animals. All right. Do you guys remember what antibody was in all your mucous membranes? IgA.
IgA?
Yes. The problem with Neisseria, like Neisseria gonorrhea or Neisseria meningitidis, is it actually has a way of deactivating IgA. So now it's in the mucous membrane of all warm-blooded animals. So let's say you have this, or God forbid you're in college or you're dorming or in army barracks or boarding school or whatever, jail, and somebody has this, all right, you're in close quarters with them, you get this, all right, in your mucous membrane somehow, it deactivates IgA. So now you don't even have that initial antibody to tag it to make sure your antigen presenting cells come across and get it, all right? In Neisseria meningitidis, all right, it gets to the meninges. What did it have to pass to get to the meninges? It had to get past your blood-brain barrier, all right? That's not supposed to happen either, right? All right, Neisseria gonorrhea. We're talking about Neisseria. We're not going to worry about the other two here because they're not really going to be that pathogenic, and you're not going to come across it as often. So I just want to focus here a little bit on Neisseria gonorrhea, Neisseria meningitidis. Great. I'm not talking to you, Siri, or Alex, or whoever you are. All right, genus Neisseria, gram-negative, bean-shaped diplococci. None of these have flagella or spores. These have great big capsules. You can literally see it here. Right there, you can see it. They have pili. Do you guys remember what pili do?
Oh, those
Transconjugation.
sex pili. Yeah, they just give like what is it? The antibiotic. They don't actually reproduce that way.
Yeah, they're giving it, they're virulence factors. They're just giving it genetic segments for a specific virulence factor. All right. Very good. All right. So I always call these double Ds because they look like two Ds together. All right. That's how I remember that. All right. These are strict parasites. Do not survive long outside of the host. So another one, you can't call me up and say, Dr. Phil, I think I got, you know, Neisseria gonorrhea from a toilet seat in building 3. Number one, it's been bleached 1,000 times, COVID, and it doesn't live long enough. All right, so aerobic and microaerophilic, right, produces catalase. All right, so it's able to deal with oxygen. Right? It can live outside for very, very short periods of time. Pathogenic species requires enriched complex media. This needs like blood agar, chocolate agar. It won't grow on a regular nutrient agar plate. Causes gonorrhea and STDs. Virulence factors, right? Look at the fimbriae on this thing. All right, so once that attaches to your mucous membranes in your throat, your nose, or whatever else, whatever mucous membrane we want to be talking about, it's not going to let go. Other surface molecules for attachment slows phagocytosis, so your macrophages, your antigen presenting cells can't even engulf it and break it down and present it. And here's the killer part right here, IgA protease, cleaves secretory IgA. So you have IgA in your mucous membranes, it cleaves it, destroys it. All right, so it's strictly a human infection. It's one of the top 5 STDs. All right, infection still should need 100 to 1,000 to be infected. All right, so that's really not as many as you think. All right, so it's relatively, that infective dose is relatively small. Right? Does not survive for more than an hour or 2 on fomites. All right, so it could theoretically survive that long. So the other thing I'm going to say, even though we're recording this, is don't share your toys, latex toys, with anyone. Just saying. Right? And here's males can get this. Right? 10% of the males are asymptomatic, all right? So most guys know they have it. Yellow discharge, scarring, infertility. Usually sometimes there's pain with urination, right? 90% of males know they have it. The problem with females is they have very few signs and symptoms, and most of them are asymptomatic, so they don't even know they have it. Females can cause inflammation of vaginitis, urethritis, inflammation of the Salpinges, pelvic inflammatory disease, can cause sterility, ectopic tubal pregnancies, and what's that when your uterus? I can't think of it. Doesn't matter. And they go in and they freeze up the lining of the uterus if it's all. It doesn't matter. All right, so about 50% of females are asymptomatic. They don't even know they have it. All right. Gonorrhea in newborns infected as they pass through the birth canal causes eye inflammation, blindness, prevented prophylactically immediately after birth. And I still think they use silver nitrate. Pretty sure they still use that. You know, I graduated grad school in 2004, so the last thing I read on it was like 2015, so it might have changed. All right. So diagnostic, we use the gram stain, but here's the thing. We have to gram stain it, but these are literally inside the neutrophil. All right, so they're literally engulfed inside the neutrophil. And we're finding out that 23% of these right now are penicillin. They're penicillin resistant right now. Even though they're gram-negative, they're still penicillin resistant, and they're tetracycline resistant. Right? Tetracycline should pretty much kill anything because it's ribosomal. It should destroy anything. And this is one of those reportable infectious diseases. This is another one of those diseases where we can go and we can treat this all we want. And if you're active or sometimes with sex workers, they have this, they get it cleared up, they go out and reinfect themselves over and over again. And even if you got it from someone, like I said, you may not know their real first name, last name, phone number, or whatever. So even if you report it, they may not know where they got it from. Right? Let's talk a little bit about meningitidis, meningococcus. All right. So before we go any further, what are some signs and symptoms of meningitis?
High fever.
High fever.
You become, what's the word? I can't think.
Oh, here's the thing. All right. All right. Number one is you have an excruciating headache.
Yes.
Comes on super quick. Like this is unexplainable. All right. High fever. And you guys know what nuchal rigidity is? Where your nuchal region is? All right. So, do you ever see a mother cat carry her kittens? How does she do it?
Oh, the back of the
Her mouth.
scruff.
The nuchal region. So nuchal rigidity. So these people literally pounding headache, fever, intense neck pain, and they're going to be knees bent, curled up. All right. The minute you go to straighten them out, all right. Herndag's test. Yeah. Oh, where'd that come from? The minute you go to straighten their knees out, they're going to punch you in the face. The pain is so extreme. So what happens is you have this swelling in the meninges of the brain, right? Swelling in the spinal cord. So when they are curled up, they're not irritating that meninges. Right? The minute you go to straighten them out, it irritates it even more. The pain becomes even more intense.
It's the scariest thing to witness. My mother had it, and she looked like she was on her deathbed. It was awful.
Did she like come on in like 12 hours, or what was the time frame?
Yeah, it was along that line, and then of course, with anybody that they suspect has it, they don't know yet if it's viral or bacterial. So you're automatically put in quarantine. You know, like they have you totally all by yourself, and you're under isolation. And everybody has to come in isolation gowns. Like it was so scary. But she was not with it at all. Like she could not even have a conversation with you. Like eyes rolled back in her head kind of a thing. And she was in the hospital for almost 2 weeks. It was horrible.
Because all that
Like
swelling
she
pushed
becomes
out of the blood.
delusional, you become delusional and just, oh my gosh, it was just, oh, it's awful.
Remember, your meninges are swollen, right? And your brain
Right.
is in this osseous container. So when it's swelling, it's pushing on your neurons. They can't function.
Yeah.
Right? The lining is swelling, pushing on your brain. That's why it becomes so lethal. Now, did they give everyone that was around her antibiotics prophylactically?
No, isn't that crazy?
That's because usually now they're just saying, you know what, you had it. Anyone you were in contact with for the last 3 days, automatically you're going to get antibiotics.
I mean, this was 10 years ago, I want to say, 10, 11 years ago. But yeah, she was in Buff General in her own room. And
Where'd she got it? Was she
well, that after all of this happened, we found that she has an immune, deficiency, but some wacky thing that she has now. But so she has to be really careful not to get sick, because if she gets sick, they're afraid that she might get this again. But she had been traveling. She had been on an airplane, and she had been home for like a day or two, and then all of a sudden came down with, like, she couldn't even stand on her own. Nothing. My dad, had to take her, rush her to the doctor's office, and they called an ambulance right away because she was just, it was crazy.
Yeah. They say it comes on within hours.
Yeah.
Crazy information. But this has capsules, it has Fimbre. Once again, it cleaves the IgA protease, so you don't even have the antibody to it. My suspicion, Dawn, is that your mom has a problem with antibody production.
Mm-hmm.
That's probably what's going on. It wasn't able to identify it or tag it with an antibody or complement.
Gotcha.
Possibly, I don't know if it was
Yeah,
bad.
I can't remember what it is that they said. Like I said, it was so long ago now, I can't remember. But there's certain things that she has to stay away from because they're afraid it would be easier for her to get it. Like certain foods they want her to stay away from.
Yeah, and people, did we do the food lab? We did the food lab, right?
Uh-uh.
We didn't this semester. We didn't. You guys didn't bring food in.
No.
Oh shit! Yeah, last year we had some. I reminded the kids like before the lab. I sent them an email. I said, guys, remember bring some kind of food in. So the one, oh that's right, it was last. He forgot, so he went to like a gas station and he bought like this fruit to bring it in. It was loaded. I go, what were you thinking? You had him rinse it and then plate it and then wash it, plate it, and then do a real light bleach wash to do it. And then we swabbed it again and plated it. This was coated with everything imaginable. So, it was actually perfect that he did that. So prevalent causes is meningitis, or human reservoir nasal pharynx, 30 to 30% of adults have it. Right. So what had probably happened, Dawn, is somebody on the plane, they coughed or sneezed or whatever, or it could have been on something from the previous passenger, because even if, you're switching planes, it's still got an hour or so where it could be on something she touched, and then they have you, before you take off, they want you to read the escape plan or whatever. Those get washed like never.
Yeah.
Yeah. So high-risk individuals are those living in close quarters, children, and young adults, 10 to 20 years old. So, if you're in a private school, boarding school, college dorm rooms, detention centers and things like that, group homes, this can spread super quick. Disease begins when bacteria enter the bloodstream, crosses the blood-brain barrier, which shouldn't happen, permeates the meninges and grows in the cerebral spinal fluid. So if you have it in your nose and something happens, it's not a far reach to get from your nasal pharynx up into your brain. You can take any kind of sagittal look. You can see how quick that can happen. Very rapid onset, neurological symptoms. Endotoxin causes hemorrhage, shock, and can be fatal very, very quickly. So if you know anyone who has raging headache, neck pain, knees flexed, hospital immediately. That's, if your kids call and say, "Ma, I have this excruciating headache. It came on within like 20 minutes. Like I've never had this before." Meningitis. You want to rule that out immediately. Oh, there it is. Yes, you have it in your throat. It's not really a far reach to go from here to here. Once it gets past the blood-brain barrier, then it starts swelling the cerebral spinal fluid, compressing those neurons. It's where you have all the swelling here. They have all that nuchal rigidity. They can cause all the blood clotting, the toxic. You saw those toxins in your bloodstream. It's terrible. So they gram scan the cerebral spinal fluid. They can do a blood spinal tap, culture for differentiation. But now we have a rapid test capsular polysaccharide. We go in and check the. Remember we had that long tube of things that we could just swab this, and we have antigen antibody reaction right away, so we can know within 20, 30 minutes the rapid test for this. Treatment of IV penicillin, cephalosporin, and then prophylactically they treat the whole family or anyone that the person was in contact with, because it can be so easily spread. And the vaccine, once again, they're taking purified protein from the capsule. They're not taking the live organism, they're just taking part of that capsule with the antigens on it and presenting it to your body with the hopes that your dendritic cells, your antigen presenting cells will present that to your immune system and say, look, I have this antigen. And hopefully, from last week, we talked about how your body makes all those B cells, really combines all your genetics, like quick pick, and makes all these B cells that are just waiting their whole life to come across some kind of antigen that will stimulate them to make an antibody. Now that antibody will find that antigen as a match, and it'll make an antibody to it, and you'll make antibodies to it, and then you'll make memory cells to it. So in the future, if you ever come across this, your body already has a recipe. We make antibodies to it immediately. We tag it, and we take it out of circulation. Right. I think that's it. All right, guys. All right, so I'm sorry about not recording the beginning part of this. I will put up, what I'm gonna do is I'm gonna send everyone an email tomorrow, Friday. I'll send you an announcement and an email. I'll put like a question or two up as a fake test. I wanna make sure everyone can get in. Just get in, answer the questions, and if you have a problem, I have to know so we can get you in the Connect system so we can get these tests up and running for you. So like I said, I will give you guys a little extra time on the exams because we don't really have face-to-face this semester, unfortunately. So I can't answer your questions and I can't go over everything I really want to go over. So I'll give you a little extra time on it. But remember, these questions are coming directly from LearnSmart. So if you go in and just spend an hour every once in a while going over reading this, and if, like I said, if you miss something, it should take you right to the book and show you exactly where it is. Have you guys tried LearnSmart yet? Anyone?
I really like that when they quiz you on the questions too, it gives you the right answer and explains it.
Is it working now?
Yeah, I mean, I've used it from the beginning, and I really like it. I think it makes a big difference. Like,
Yeah. Well, statistically, they're saying across the board, anyone who has LearnSmart always has 1 letter grade higher. So,
I mean, those questions that they ask you, it's nice because, like I said, it gives you, if you answer wrong, it gives you the right answer, or like there might be 4, like 6 options, to answer, and it says pick all the things that apply, and you pick 3 instead of 4. It'll tell you you missed this one, and that's why, or whatever. So it's nice. So it's nice because a lot of times too, I'll take extra notes from those questions. I'm like, oh, if it's asking this, I'm gonna need to know this. So
My LearnSmart doesn't look like that. My LearnSmart is ask you a question. It could be multiple choice. It could be fill in the blank, and
Right.
you press like I'm sure I know the answer, unsure, and if you're unsure, that they repeat the question.
They don't, when you say, okay, so when you put in, okay, so a lot of times I'll just put I'm sure because I usually have a good idea. But if I put in the answer, if you have to type it in
Yeah.
and you click, it'll say, nope, you were wrong. And if you were wrong, it'll give you the right answer. It doesn't do that.
Yeah.
Even
Yeah,
if you spell it off by 1, see that,
Yeah.
that's not good.
Yeah. So it gives you fill in the blank or multiple choice.
So are you doing Learn Smart or Learn Smart Prep? I guess I don't know the difference.
Oh, it's just the Learn Smart. I don't know.
Brianna, what are you doing? Learn
I'm
Smart
doing
or
the Learn Smart too. I don't know what the prep is. Haven't clicked on it.
Yeah.
So like I can put stuff in on purpose. Like I can go in and say chapter 18, I can make it anywhere from an hour to 2 hours like that. But I generally don't like to do more than an hour, and then it'll give you that. If you miss something, it should take you back to the book. But you guys, if you have a Connect code, you can go in and you can do Learn Smart Prep, and you can go in and it'll give you all kinds of interactive stuff. And if you're wrong, it'll take you back to it.
Huh. Okay.
But I only ask you stuff that I went over on the PowerPoint and well on WebEx. But last week I know we recorded the whole thing. I'm really sorry about not recording the beginning, but next week, please remind me, make sure that I'm recording it. So unfortunately, whoever missed the first part of the WebEx, I feel bad. But if you know any, or if there's a problem where you can't, like something comes up and you can't do the WebEx, like I said, I will try to record it and we'll put it in, go to virtual meetings and go into past recordings, all right? And if you guys ever want office hours, just email me and I can do a private WebEx so we can just cam back and forth. If you have a question or say, I understand this, or I missed this part of the PowerPoint, or I did in my notes printed, can you go over this? I don't have a problem with that at all. So I'm here to help you guys. I know you guys, it's stressful. It's, believe it or not, it's stressful for me too, because I don't have the face-to-face combat. I don't know, I haven't seen or heard from half of your class.
So you're not doing any kind of I know this is totally off subject. You're not doing any kind of pharmacology class this coming semester or summer or anything?
I want to talk to Dr. Lucido about that, but I think she has to put that in. But
I keep looking for one, and the only one is nursing, and I think it's only for the nursing students, and they canceled they canceled my nursing program for the evenings for the fall. I was supposed to start this fall.
yeah, everyone's having a problem. So that's a really good, Dawn, thank you. I'll talk to Dr. Lucido and see if I can get her to request a pharmacology course, and then maybe I can do that online.
Because that would be great.
It's at Cayuga. So
Okay.
I talked to Dr. Lucido and I'll talk to Joanne Kammerauer and see if I can get that included.
Because
That's
that
really
would
good
be
to know.
awesome, because now to try to get into a different program, they want you to have pharmacology, so it's like kind of getting screwed over by ECC right
We
now.
have a problem with financial aid too. Like, if
It's
you're not taking,
there's oh my god, it's just a whole effing nightmare. I can't. I'm just so upset with that nursing program that they made us jump through all these hoops, met all their deadlines, took their test, and oh yeah, just get an email. Oh yeah, we're not gonna have it now, and it's like, oh, that's nice. Like they didn't even care. It was like
we
so.
want to, it's just SUNY. SUNY's saying no, and the problem is
Oh,
like, if we were in, like, if I found like SUNY Delhi where there's no cases, I could say, yeah, you guys can go to SUNY Delhi or SUNY Oneonta or whatever. But they're saying, well, it's SUNY, so you can't have class in one SUNY system and not the other.
no. It's not even about that. It's they canceled the evening program. So if I signed up for days, I could still go. They canceled the evening program. They just all of a sudden just was like, oh well,
Wait,
we
what?
decided that yeah,
What semester? Are you talking about fall?
to start in the fall. There was a whole group of us that took the test, did all this stuff, jumped through all their hoops, met their deadlines. You had to apply by February 15th, do all this stuff, and all of a sudden we all got an email when we were supposed to be getting an email saying you got in. We got an
Right.
email saying, yeah, decided that we're going to cancel the program for evening.
All right,
And so you can't apply to any other programs because they already had their application deadlines, just like ECC had an application deadline, and they already had their tests, their acceptance tests and everything, and yeah, so we miss out either on a whole semester or we miss out on a whole year
yeah, but see,
getting into a program, and it's so piss poor of them because they offered it, so we all signed up for it, and now it's like, oh, Oh, well, sorry.
Well,
It's
hold
like,
up on that because you might be able to, let me call Patty, Dr. Lucido, and I'll find out why. If I know Dr. Lucido, there's a reason. Like she's
well,
not, there's gotta
I
be a reason.
emailed the president of ECC, and he didn't even
Yeah.
apply. He didn't apply to me. Yeah, he didn't apply
Yeah.
to me. He forwarded it to the ECC nursing program, and
Dr. Lucido.
then they emailed me, and it was actually that Lauren Watkins that emailed
Okay.
me, and she was the one that sent the initial email, and she said that, well, under really hard consideration, we just felt we couldn't find the right staffing for the evening program, so we decided to cancel it. And it's like, well, you just left us all totally screwed over.
Yeah, that's not your problem, that's their
Yeah.
problem.
Yeah. So it's like, how the heck do you do that to all of us? Like, all this money we put in and all this time for you to meet your deadlines, and then like the thing is, it was the way that the email was presented. It wasn't even like, we're so sorry. This has got to be so hard on you, and we're leaving you stranded. It was nothing like that. It was like,
Matter of fact, like that's take it or leave it,
yep,
tough
oh
shit.
well.
And,
Like,
yeah,
too bad for you. It sucks to be you, I guess. Like, and it was kind of like, wow. And it was, well, you
putting
can
it.
always join the spring program if you can get in, for daytime. But we all signed up for the